Good evening, everyone. I'm Akash Lapinder. It's wonderful having you back with us. The numbers are still being crunched, but we do have a better idea of what financial blow Hurricane Dorian has dealt the national budget. Deputy Prime Minister and Minister of Finance Peter Turnquist telling reporters this morning that initial estimates are that revenue will be hit by a $200 million shortfall.
Abaco and Grand Bahama represents somewhere between 15-20% of our GDP. So this is it's not an insignificant loss to the economy. But hopefully the reconstruction, the inflows of insurance proceeds and people putting that to work to rebuild the economy, hopefully that will offset some of the touristic losses that we expect and we'll be able to get these communities up and going and contributing again very shortly.
Quite a financial setback, to say the least, one that leaves the government to come back to the people with a revised plan.
The Fiscal Responsibility Act requires us to come in November with our fiscal projection outlook for the next budget season. So we will make whatever adjustments are necessary during that time. And then when we come to Parliament to present that revised report in, I think it's January, early February, we'll be able to outline exactly what has happened, what the effect has been, and how we intend to adjust our fiscal outlook going forward to account for it and to get us back on track.
Now, as for those lump sum payments to the public service, the DPM says there's still a desire to do so. It's now a matter of being practical and reasonable given the unexpected expenditure over the next couple months.
As you all know, this is a significant, unexpected event for the government. And so we have to make sure that we properly budget and consider all of the ramifications for our expenditure over the next couple of months for sure, until we've determined and been able to put concrete numbers to what our outlook is going to look like. So at the moment, it's on hold, and we'll see how we can adjust it, maybe see looking towards the end of the year to see how we can maybe fit it in.
On Monday, India donated $1 million to hurricane relief efforts. Meantime, Environment Minister Ramald Ferreira estimates it will cost tens of millions of dollars to move some 1.5 billion pounds of debris out of Abaco post-Hurricane Dorian. You see, while potential laydown sites have been identified on the island, Minister Ferreira says it will only swamp the Abaco landfill.
Marsh Harbour has a landfill. It has its challenges, but that's going to quickly overwhelm any kind of situation. And of course, we have to separate the debris. There's going to be concrete, rubble. There's going to be vegetative debris. There's going to be metals. There's actually a boat sitting on top of a roof in Marsh Harbour. It's quite something to see, which gives you an idea of how high the sea surge was and the kinds of impacts. So the waste has to be collected. It has to be sorted. It has to be reduced in volume, which usually means a shredder or some cutting devices. And then, of course, we take it out to press.
Removing the debris will primarily be carried out by the Department of Environmental Services. The minister acknowledging, though, that determining the amount of debris left behind in Grand Bahama has been a task.
The debris management plan calls for a certain kind of expertise to do the sorting. Because remember that the entities receiving this, they want it sorted in such a way. And then, so that calls for manpower, that calls for expertise, that calls for planning, that calls for aerial footage, the whole 9 yards. One of the reasons why we can't estimate, or we've been unable or challenged in terms of estimating debris volumes in Grand Bahama, is that a lot of the damage that happened to the homes in Grand Bahama happened internally. So people they basically have a house. The sheetrock is all damaged, the appliances are all damaged. So it's a different kind of feature. And so we're really going to have and develop two separate responses for how we deal with the damage and debris generated from that.
The government, he said, is taking advantage of the expertise provided by its international partners. Getting Abaco and Grand Bahama's healthcare facilities back on their feet, also not chump change. The health ministers pegged that to be in the millions as well.
We are going to take an educated stab at putting a dollar amount on it, which we realize will be modified as we get the full assessments in, just to give the government, the cabinet, a working range. Understand that health, works, education, all of the various government agencies and ministries are doing exactly the same thing, but this is an imprecise science at this point, given the fact that formal assessments just could not be done.
When asked the long-term effect Hurricane Dorian's damage will have on the country's healthcare system, here's what Minister Dwayne Sands had to say.
We don't really know. Certainly, we have benefited from tremendous offers of assistance. And if those offers come to fruition, it is possible that the healthcare system could emerge better after Dorian's recovery than before. But we just have to see exactly what comes to fruition. We have had some very, very generous offers made by international partners.
Mobile and fixed volunteer teams have been stationed and providing care to areas where clinics are partially operational or non-operational for that matter. Numerous NGOs have also aided on Keys. The Heart to Heart International Group is working out of Treasure Key. The Rubicon Group is offering health care at Hope Town, and Humanity First is assisting in Cooperstown, Abaco. As for Grand Bahama, the Rand Memorial Hospital is partially operational, having been significantly damaged due to flooding. High Rock, McLeanstown, and Pelican Point were destroyed, and International Medical Corp is providing health services to those areas. Meantime, health fees that is, waived for those displaced by the storm, and this includes dialysis and cancer patients. You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive. This segment of the news was brought to you by Alive.